The effectiveness of CBT in 3 to 7-year-old anxious children. Introduction. Anxiety disorders are the most common form of psychopathology in children and adolescents, although there are great variations reported in the actual rates of the conditions. Klein and Pine reported that 5 to 15% of children exhibit symptoms of an anxiety disorder at some time during their development, while Verhulst found 23% of a large adolescent cohort to show such a disorder. These differences may reflect variations in defining a disorder by different authors, but may also be related to age-specific peak onset times for specific anxiety disorders. For example, separation anxiety disorder has its onset most often during early childhood, while social phobia is more common in adolescence. Nevertheless, it appears that the overall prevalence of anxiety disorders is virtually identical in preschoolers ages 2 to 5 and children and adolescents aged 5 to 17. Ager and colleagues used their recently developed preschool-age psychiatric assessment to assess 307 children aged 2 to 5 for 8 diagnoses and found a rate of 9.5% for anxiety disorders. One additional challenge in diagnosing anxious young children is their inability to reliably report on their feelings and behaviors, necessitating questionnaire-based information from parents to obtain a diagnosis. The treatment of young anxious children has received little scientific study. Thus, while there is good evidence for efficacy of cognitive behavioral therapy in children aged 8 and older, there is presently only one empirically validated psychosocial treatment outcome study for anxious preschool and early school-age children. In this pilot study, Munga and her group enrolled a total of 32 children aged 5 to 7 years in a 12-week, carefully developed manualized CBT group program and compared them to 11 children on a 2.5 to 5 months wait period. Groups comprised 5 to 8 children and parents were mostly seen separately during the time of the group meetings. Results showed that, among others, 43.8% of children no longer met criteria for any Axis 1 anxiety disorder after the group treatment based on well-validated assessment measures. There is also one promising report of an individualized approach by Scheringa and colleagues. They discussed 2 children aged 4 to 6 who had experienced the flooding of New Orleans and showed signs of post-traumatic stress disorder, as did their mothers. The results of both these studies indicate that the CBT program, including mothers and their children, is not only practically feasible but can lead to a significant decrease of anxiety in both. While commonly used manualized CBT programs for older children, such as the Coping Cat program, involve the parents of the treated children only in a few specified sessions, the data by Munga and Scheringa indicate that parents have to play a more important role in the treatment of preschoolers. Moreover, since the relative cognitive immaturity of young children limits the use of some traditional strategies, such as exploring the evidence for faulty beliefs, the treatment approach must be based on more concrete cognitive abilities as well as external support. Finally, a recent meta-analytics review showed a substantial association between child anxiety and parental control, further highlighting the need to actively involve the parents. The present study is an attempt to evaluate a modified cognitively based individual treatment approach with a larger sample of young anxious children using age-appropriate valid tools and actively involving the parents in the treatment process. More specifically, we hypothesized that preschool-age children will show a significant decrease in anxiety symptoms and improvement of their global psychological function following a 2 or 3 month period of weekly CBT.